Look, the idea is to have an equitative balance in all the region. Without further ado, it is an honor for me to introduce to you Dr. Marta Gonzalez, a researcher from the Gran Colombia University, a PhD in law, a specialization in social security in Stargroup, the Universidad de Castilla-La Mancha, and she has worked at the CIS technical advisor of the employer sector of the international of the ILO since 1989, teacher, professor in her university, member from the Ibero-American Academy for Rights of the Worker, an international speaker, uh, author of several papers, and she has collaborated in more than 30 books with this subject matter. Thank you for collaborating with us. Thank you so much, Dr. Brandon, for your generous introduction. Good morning to the distinguished and selected audience that we have in the headquarters, as well as those that are here with us remotely. My uh, regards for having me here and for inviting my university, the Gran Colombia, and for giving me the opportunity to represent my country in this important conference. Thanks to the organizing committee as well as to all the technical committee, my sincere regards. Because we have some time constraints, I would like to focus on the content of my presentation. My presentation has an introduction, international standards of of the ILO, uh, the law for work harassment in Colombia, Agreement 190 in 2019, domestic violence, their causes, increasing concern, mental health, and conclusions. This is the table of contents for my presentation. It is really important to analyze the context in order to reach these conclusions because there's no effect without a cause. For me, it is a great commitment after listening to the great presentations that we have received during all this week. I will try to do the best I can. The great transformations in the labor world for different causes like globalization, internationalization of economies. This is not a new phenomenon. However, they demanded a lot of changes in work labor so they can be more flexible. Outsourcing has been satanized, but it has disregarded what does it mean regarding the improvement of procedures and services with high degree of specialization, as well as the economy, because they are working with volumes and it's eliminating the cost of error because they repeat operations. Market openness brought in um, a lot of competition that is not loyal in a brand new industry. And of course, Latin American people provided work and labor guarantees in face of the Asian markets. As a result, we saw a change of location of different corporations. Some of them have closed up with negative results. The economic crisis in 1930, the Asian tigers in 1987, and the financial crisis in the US in 2008. Out of all these crises, we learned few things, few experiences, the two worldwide, the 4.0 revolution, the disruptive era that was a quite challenge for the transformation in the means of work and the training to be adapted to those of them. Pandemic, the great surprise that was not foreseen for all of us, and we were obliged to stay at home to avoid infection, and this transformed our lives. And once again, wars between Ukraine and Russia, Israel and Palestine, and the threat for a nuclear world correspond to an overview of the things that has happened in almost a century that has shocked the world, but that it has meant undoubtedly huge challenges and great amounts of resilience. I don't want to be very negative, but we have to talk about all these facts that have marked the humanity with a history of changes. So we can state that today's world is different than the one that we had 70 years ago. We have had the privilege to accompany a lot of these changes that belong to our closest history, and it has great repercussions and very sensitive global transformations. International standards of the labor, the ILO, out of the 190 agreements adopted by the World Parliament of Labor Right and Social Security, and this has been recognized currently. We have 10 fundamental agreements, and they were added to to the 111 conference of 2003 with the agreement 152 and the recommendation 202. They were addressing different issues that have to do with social security matters. 82 of those agreements and one protocol are related with health care and health in the workplace. The organization was concerned about this. So in agreement 152 of 1952, they presented the minimum floors for social protection. It is important to notice the low rate of ratification of this agreement when they started by building their recommendation in the year 2011, that after the parliamentary agreement, it became the 202 of 2012, underlying the importance to have minimum floors for social protection. And we could think that the effects of that recommendation regarding the ratification of the agreement has represented a significant progress, but that's not the case. It increased only to 43 ratifications among state members due to the cost that this represents to all of them. It is not a secret that Social Security is highly costly, and the funding for its sustainability are the strongest challenges that we should face because they are linked to universality and the quality of services. Regarding Colombia, and because it is a guest country, I am going to emphasize on the Colombian situation. It is worthwhile to notice that we have 61 agreements that have been ratified and 52 agreements that are currently on duty. But regarding the process to include the social protection floors, I am not going to elaborate on that because yesterday Dr. Christian from the External University of Colombia, my dear colleague, gave a great presentation about that same subject matter. The only thing that I would like to add is how relevant are other instruments. Instrument 5. We call them the instruments of the 100-year celebration. that were enacted on the year 2009. It is about the report that the high level commission, integrated by 9 experts from different nationalities, comprised, and that we know as social, universal social protection. This document has strengthened all these questions about if we need to talk about social protection, social security, if it's universal, if they are systems or not, or if it's really a valuable instrument that we should take into account because it's very relevant. So, as a parenthesis, in order to continue expressing that there are no studies outstanding to set for, as it should be, the causes for low ratification rates, starting from the basis that the coactive power of the ILO are not enough severe, and they have said that the ILO has no claw. Therefore, nothing happens to those state members that are not afraid to say that they are not willing to ratify this agreement. In the year 2023, there were millionaire figures that account for 3 million workers that are dying in work accidents. Out of them, according to the ILO, 2.6 of deaths are caused by diseases related with work and labor, and 330,000 for labor accidents, forgetting the constitutional factor of the production of richness and employment together with the capital that are the workers. These figures have promoted the attention and the development of standards for prevention and control that will result in the decrease of alarming figures. So they are constantly talking about how necessary is to adopt agreements that are going to rule this subject matter in order for the surveillance and control activities to be enacted. The act of labor harassment in Colombia. Why do I want to talk about that? Because we should say that this was the background for what a new agreement became in the year 2009 and 19, because we consider that there were no more need for agreements. Actions should be specific for reviewing and updating and reporting those that are not appropriate for the current moment. So they decide not to ratify existing agreements to learn about the causes for the lack of compliance of that commitment. The Piece of Act 210 in Colombia that prevents, corrects, and sanctions all acts that represent labor harassment in different modalities, among them we consider sexual harassment with high percentages and its variables. In the year 2021, in the Ministry of Labor, 2,227 cases were reported, because this is the administrative entity that is responsible for this. After addressing all these matters internally in the corporations before the corresponding units. Unfortunately, these cases are mainly against women. In other countries, we have other denominations for harassment, bullying, psychological violence, sexual harassment that unfortunately have women as a target and their condition as mother and provider for the family or single mothers should be silent before all these abuses that are generally um, done by their immediate boss. And another great difficulty regarding the test is the test and the evidence, because witnesses are not allowing or willing to speak out and they become silent witnesses. Today, with technology, these means of evidence contribute to verify those acts of labor harassment. So, as a result, they can be solved easily. Notwithstanding, with these all cases, they have exceeded the environment of work and they are occurring in educational places like primary schools. And this is a scourge. In many cases, we see that there is a lot of impunity, discrimination against women in all these cases of labor harassment has been quite evident. The reason to defend their job is something that the harassed woman has to defend. All these cases have a great impact in the mental health and in the occurrence of labor accidents, as we will see further on. Agreement 190 from 2019 or the agreement of the 100 years celebration. In this year, we started to discuss the report that will become an agreement that should coincide with the celebration of the 100 years in order to have a relevant instrument to celebrate this anniversary. We should highlight the insistence of not for not having more agreements, but to review the past one that have been adopted for more than 100 years and they need to be updated. This is a task that is happening now, and they are reporting all the agreements that have to be updated for the conference 112 that is going to be carried out pretty soon in June. 8 agreements will complete their endless process of report without, and sometimes it's so difficult to reach consensus on these international instruments that is worthwhile to remember that there were many sessions that were organized in order to define quote unquote violence in order to have the same meaning in the three official languages of the ILO. Those sessions were very long, and it took a lot of time for them to finally reach a definition. The issue of definition has been addressed for many times in different agreements, as well as the need to protect women from abuse and discrimination because it has an impact in the mental and physical health of the workers that have been affected by that. For Colombia, it was very nice to see that as a country, we were able to contribute for more than 10 years with this act for labor harassment. There is a global brigade that promotes the ratification of Agreement 190 by state members. On February 23 of this year, 2024, Colombia ratified an initiative to table this before the Congress. But with all the reforms that are being proposed by the current administration, the legislative capacity is overwhelmed. We know that Mexico ratified this agreement on July 6, 2022, and they have a 1 year term to design the appropriate pieces of act. Domestic violence causes an concerning increase. The characteristic of a society, quote unquote, machista, inherited from other cultures that had an influence in our idiosyncratic, like the Spanish one, with 4 years, 4 centuries of Arabic domination, where women were submitted, were not enough recognized with rights and guarantees, was a legacy to our cultures. The fact that women in Colombia only till 1957 had the right to vote, with recognizing that they had citizens' capability to vote. But something even more interesting is the fact that they have to use the last name of the husband as if she belonged to him. But fortunately, this was eliminated on that same year. So these are just a sample of the consideration of women in Colombia. But now they have access to university schools and to studies, and that they can participate in the supply and demand of work. And agreement 152 and 111 of 1951, adopted by ILO, about equality of opportunities and salaries, we have to make sure that these are going to implement. And there are some laws of millimetries where they are obliged to have access to public works in a percentage of 30% for women. So in a photograph of the High Court, you can see that this is not being implemented. The fact that women can be considered only for home care, work that is not remunerated, and for raising children created a dependence on their husbands. And because she was not trained to work, uh, the family environment created this situation that they needed to support the violence and the bad treatment of their husband because she couldn't provide for her family. This situation was changing with the economic independence of women that oftentimes had uh, eh, higher salaries than their husbands with the modern denomination. We cannot state that violence is generated only from husband to wife because it's now generalized towards children. And it's the response when they don't like any circumstance, and increasingly we see acts of higher violence and even cruelty. We have seen a lot of proliferation of cases in which an abused woman that has been tired of that abandoned her husband, and the man looks for her in order to uh, look for revenge of this case. And this chaotic situation coincides with the migration of people leaving their places of lockdown. So now societies are violent, intolerant, and seems to be that everything is going to be solved with um, punishments, and this hasn't happened overnight. It has been a process, and we should analyze all the causes in order to understand the situation and to look for some um, ways to solve this scourge. Among these causes, it's important to think back family as the cell of the society.
It is then worth questioning if families today are similar to families back 40 or 30 years ago. I'd say arguably not. We had important factors such as respect and discipline, concepts that have been reevaluated when we go against the full development of personality and freedom, and discipline goes against free will as well. Parents became mere providers without any supervision or control authority. It was conveyed to teachers who are not able to scold children with the risk of having repercussions to them. Adjusting to these society changes has been no easy task, and it hasn't been easy as well for the way families are made up. The increase of violence and intolerance wasn't gone with these society changes. It is considered the only way to solve conflicts, even though there is dialogue, agreements, and all the possible means to fight against conflict. Despite all of that, our society is still violent and lacks tolerance. We have seen that in some countries, violence has been rising with more intensity and even with unforeseen cruelty. Oftentimes, we see irrational conducts. Therefore, I would like to affirm that we are mentally ill. This is nothing far from the reality that has the causes we just mentioned, and we will deepen further down the line. In Colombia, as of October 2022, the Department of Legal Medicine highlighted 30,492 cases, commonly of partners, among and followed by other family members against the elderly and children. And if I take a look at the figures in Mexico, the figures are really high considered the volume population. So, what are our societies doing to fight this intrafamily violence that has enormous cruelty features? Policing, isolating, hotlines, help desks, women protection groups for those who are victims of family violence. Sometimes these cases are not denounced mostly because there are repercussions. The effects of technology, with all its possibilities, exist. However, they haven't been properly executed. Violence is a day to day for children. They are exposed to situations where violence is the answer, with cruelty being shown way beyond what should be. The content sometimes should be along with adults, but it is not the case. We are living the consequences of lack of control. Even cartoons portray violence. The lack of education in the management of technology and the way we absorb it has a lot to do. And the effects of that mental disease that is extended on the population, the healthcare system, especially those who address mental health care, will be saturated soon. Violence is not a heritage of societies that are developing, such as my society. We hear from young children, even children, who kill their peers without any reason, just because they are repeating scenes copied from somewhere else. So, violence has this deep component of lack of education regarding the topic of control over the massive means of communication. Are we doing something to eradicate this violence that seems to be endless? We have state policies that control this mass media of communication. There are psychological risks and mental health. According to the definition of the Mixed Committee of the ILO and the WHO, and I quote, the psychosocial risks are the interactions between work, the environment, job satisfaction, and organization conditions by a means and the capabilities of the worker, their culture, their needs, and their personal situation outside of the work environment. End of quote. It is precisely with the institutionalization of the World Day for Social Security on April 28, 2016, where the ILO starts referring to the stress related by the work, which is determined by the ILO, the design of work and job relations. This happens when the demands of the work do not correspond or exceed the capabilities, resources, or abilities of the worker, or where the knowledge or the skills of the worker or a group are not enough to face the expectations of the company. When we talk about occupational health in Colombia, we talk about more than 100 years of story. Because in 1904, during the Rafael Reyes administration, the Public Health Department was created, talking about occupational health. Then we had more laws that developed on the topic. The 90 law of 1946, where the mandatory social security was created, and the Colombian Institute for Social Security, we have the protection of the insured in case of professional health or damage. In 1950, we have the National Institute of Health with a division of occupational health. With this law of 1970, we increased the specialization, and in 1979, we officially have a governing law on work health. These on three action areas: worker health, worker environment, and inspection, surveillance, and control, with the issuance of specific guidelines to create safety and to develop guidelines regarding the legal duty to create real occupational health programs. And then we see the creation of specialized companies. The 1562 law of 2012 created an occupational health program, and it works as the management system for safety and health on the workspace. However, situations due to the unforeseen situations such as COVID-19 transformed our habits, including the work habits. And there is no doubt that this can have an effect on mental health in our population, which is something that we have traced with figures that talk about this. The design of work, the relationship of the workers that is conveyed during the two publications of both international organizations changed. They went to improper spaces without the necessary elements. This was the situation for several people who developed all sorts of works and duties without the proper spaces or without any adaptation whatsoever. And it was not designed for working. This created a large burden of stress. We have different generations living together because the adults went back to their workplaces and the sick went back home. And this increased a lot the hardships for mental health, which were stressed out. Some, of course, had more favorable conditions, but they were on total isolation because they lived alone. They weren't able to go outside and they were dependent on services that are provided at home. It was a trauma generating event. So, as conclusions, I bring the following: the permanent re- coexistence of different generations and the circumstances and behavior accelerated the processes of fatigue and insatisfaction were transformed into pathologies that were not detected or readily served. And facing this lack of attention, they were increasing and became crises at several points in time. Not only stress, damages to health, muscle and bone disease due to lack of ergonomic places, overeating due to boredom and fatigue, overweight that overweight that happened due to the lack of exercise due to the constraints at home, insatisfaction as people feel that they were stripped out of their lives. Depression, anxiety were things that came out during the pandemic and still come out as a consequence thereof. And if we add to this list of consequences, when we go back to the quote unquote normality, we'll see loss of work positions and conditions that created more stress on the families and the circumstances regarding politics, economics, and society that several of our countries experience. All of this created an increase in domestic violence, cases of suicide, and an increase on mental pathologies. This created an overburden for health systems. The climate of uncertainty in which our countries are immersed due to political and social situations, the constant thinking about the future, the loss of employment or close of economic activities as a thought is increasing an alarming rate, and it affects the mental health of our peoples. It is another burden, yet again, for our health systems. Thus, we immediately need psychological help for families, especially for the young ones facing lack of opportunities. We see them really disoriented. The situation is not easy, and we need to act decisively to face the situation. With the arrival of technology and the professions that were going to disappear, we saw psychology on the list, and we believe this is being reevaluated due to the effects on mental health. And we oftentimes see that it is necessary to have a family psychologist or a psychological counsel. Thank you very much.
Yeah.
Thank you very much. Apart from this, you provided a context on the international policy due to the COVID-19 pandemic. As part of this week, we have a special moment for COVID-19 learning lessons. But I believe you have another focus that we must consider, and it provided richness to your intervention. We have a couple questions for you, and we will ask them one by one so you can develop further down. You mentioned a couple of them, but I don't know if you wish to go deeper into this. First one we have on social media is facing the big challenges in the work sphere. How must the health on the labor space must be modified to protect the workers on increasingly demanding spaces? Thank you very much for the question. I would like to stress out that these large changes bring along several demands. Although the figures are really concerning regarding the job loss, I believe we must manifest that we have seen new employments being created, and there are more to come because technology is fully blooming. So the question is, what will happen with this development of new job positions? We need to analyze them from the occupational point of view, and we need to establish what are the environmental, physical, and all other risks that surround those new job positions that are just being created. We will need to modify these systems, adapting the protection to the new employment. Changes are still happening, modifications are still happening. We are constantly changing. And in all of this, education has a great impact. That's why we insist time and again for the university sector and universities, we need to innovate for these new professions. And it goes hand in hand to be on the lookout to see what are the risks from the health and work perspective. An example of this development is the lack of connection that we saw first in Spain, and it has been extending to our countries. The disconnection for us, it meant like something wasn't blocked, but this need for disconnection meant that we were hours on end facing devices of different species. So I really do not believe a lot in that, in this disconnection. And this is simple. Even if the employer has all the means to unplug the system, we are experiencing an addiction to devices. We cannot eat, we cannot speak, we cannot be in a meeting without our devices right next to us. We are not really being disconnected. So we need to see those new risks. We need to see the protective measures and we need to make them efficient. And that's what we are not doing. We are not enforcing the right to disconnection that helps to create a buffer against this whip of mental health conditions. Thank you. It is really complicated.
Another question. Before the increasing concern about domestic violence, how the public and private sectors can contribute to prevent this problem in a comprehensive manner from the work environment? Thank you so much for this interesting question. In a nutshell, state policies, and there is a lack of them. However, once again, I would like to mention something very relevant: education. We should give a lot of priority to educate. And once again, what happened with family? Family used to be the cell, the foundation of the society. If there's a culture of respecting individuals, respecting family relationships, personal relationships in the work environment, in the educational environment, everything would be different. But unfortunately, there's no even citizens education in Colombia. Unfortunately, we used to have uh, a subject matter at school that was civic education. We learn about citizens' right, respect to citizens, but seems to be that uh, that subject matter was old and they decided to remove that from the curricula. However, it's very necessary to go back to those uh, rights, to those duties as citizens, to learn to live and to co-live together. And when I'm talking about community, I'm referring to all the environments where we have to be part of. That would be the best education. We need to go back to those principles to learn about those good costumes, to respect others and to treat them with dignity. I think that that is enough and that is much better than enacting pieces of law. Thank you so much. So much. If you allow us, we have another question. What are the challenges and opportunities that you have identified by implementing Agreement 190 in the case of Colombia and in the case of the Mexican ratification? What can we do in order to have a proper implementation and to maximize its benefits? Well, with all due respect, I cannot speak out about the Mexican situation because what I know is that they have ratified it on July 6, 2022. However, I don't know anything about the secondary acts or the regulations that were enacted for that agreement 190. Well, I think that anything that has to do with violence and harassment are not new subject matters at all. All the legislations a long time have been addressing thoroughly or um, in the surface clear pieces of fact. I am talking about the case of Colombia when they designed 10 years, more than 10 years ago, in the year 2006, this piece of law, the Act for Harassment in Jobs. So challenges have not only to do with designing law. I insist once again in education. The foundation is education, creating a real culture that, like a magnet, are going to stick up to the human being so they can become their behavioral standards. In the case of Colombia, we are known as the country of the law, the country of laws, because we have different laws, different flavors, different colors of laws for all the tastes. But what happens? They are ineffective. Then, therefore, the challenge is to make them effective. So these standards and laws can be effective. And this is not done through sanctioning or punishing them. And I insist 1,000 times more. Education. I do believe in transforming society towards a society that is going to be better because society has lost its direction. And that's the main challenge, the real challenge. Opportunities, we have plenty of opportunities. As much as we look backwards and we learn from good experiences and we extract from them all the positive things that were experienced in the past, that would be great because we are prone to disregard the good things that happened in the past because we consider them old or irrelevant. They belong to the past. I think that we need to recover the past, to rescue the past, because there are good costumes. There were good costumes to respect others and to have a good discipline, because what we are living now, it's chaos as a result of the indiscipline, because everyone can do whatever they want and they don't um, abide standards or rules. So these are the challenges and the opportunities that we have before us. Thank you so much. Thank you so much, doctor. And before wrapping up with this panel, on behalf of General Secretary, we would like to hand you over a token of our appreciation, a book celebrating 100 years of Social Security. To you and to all the participants in the headquarters, we would like to thank you. And this is a token of our appreciation, a great gift that I am going to uh, take to the library of my university. Mr. Alcantara, please. Mr. Kuhn, you are going to receive the same book, but in English. Thank you so much. Thank you for being with us all this week. On behalf all the member institutions, we would like to thank you for being with us in the headquarters of the CISS.